My topic is dental caries, and let's start with a short introduction. The oldest existing evidence of dental caries is in a dinosaur estimated to be 100 million years old. Its skeleton is exhibited in the National Museum in Ottawa, Canada, and is the only known case of tooth decay in dinosaurs. In the asphalt mines of the La Brea Ranch in Los Angeles, California, the jawbone of camel, estimated to be 75,000 years old, was found to contain teeth with clear evidence of decay. As for the ancestor of man, it is assumed that some of the skulls found are missing dead due to dental caries. Dental caries is as old as mankind itself. It's the most frequent disease considered by the World Health Organization as the first oral health problem. It's considered a universal disease, as there is evidence of its appearance, signs, and symptoms linking it to the emergence of man, regardless of race, sex, age, geographical location, or socioeconomic level. It affects more than 19% of population. Its increase has been associated with social development and variation in dietary habits. Its tooth carries on in recent years as tendency to decrease has been determined mainly in children under 50 years of age. Its behavior varies from country to country because factors such as health system, culture, eating habits, and environment have an influence. A 41-year-old female patient came for consultation with several dental caries, including significant pigmentation due to fluorosis, a condition caused by overexposure to fluoride. The tooth initially presenting has the white spots, which become permanently stained and progress to brown and finally marble teeth. The enamel in turn now tends to be destroyed, thus leading to the formation of cavities, lesion, or cavities. It is concerned that if not taken care of immediately, a more complex pathology could develop. She mentioned that she would like to remove all the cavities in order to have a healthy oral cavity and in turn a more beautiful appearance. A picture was taken of her oral cavity in both arches showing all the cavities in her mouth. In the initial clinical examination, a hard protuberance was observed in the upper jaw on one side of the right first and second molars, which was identified as a palatal torus. Both arches showed caries predominantly on the upper and lower molars and premolars, as well as dental fluorosis. Treatment plan discussed and noted by the patient. 8 caries were eliminated from the upper jaw and 6 from the lower jaw, dividing the treatment into 8 appointments. The appointments were divided as follows. Okay, in the first appointment, first and second upper right molar. In the 2, first and second upper left molar. In the 3, first and second upper right premolar. In the 4, first and second upper left premolar. In the 5, second lower right molar. In the 6, second lower left molar. In the 7, first molar and second lower right premolar. And finally, first molar and second lower left premolar.
First step before removal, the corresponding region was anesthetized. For upper molars, the technique of looking the posterior superior alveolar nerve was used, and for lower premolars, the looking of the middle superior alveolar nerve was used. As for the lower dental pieces, the looking of the dental nerve was used, which anesthetized all the pieces of the desired side up to the midline. Once the area was anesthetized, a cavity was formed until the caries was completely eliminated. Cavity was finally etching as it was placed, which worked as a bonding system between the dentin or dental enamel and the falling material in the restoration. Then we cleaned it with 2% chlorhexidine and reset. As in this case we are dealing with shallow cavities, it will not be necessary to use a base. After cleaning with chlorhexidine, we will use adhesive so that our resin sticks and doesn't fall off when polishing. Adhesive was placed, resin was placed in a way that gave anatomy to the tooth, and once this procedure was finished, we proceeded to use articulating paper to identify any high contact point. It was polished with low pitch and diamond polish. Once polished, we gave final brightness with permasil, and the process of elimination of the caries was finished. This procedure was repeated on each and every tooth with caries during the patient's hair appointments.
Okay, in conclusion, of course, eliminating dental caries will help you to have a more harmonious oral cavity. But leaving aside the aesthetic process, it's necessary to take into account that it's necessary to put our oral health has the first motive, since if we avoid problem and do not treat the caries in time, it will continue to advance and will end up attacking the dentin.